Hi students, this is me Dr. Aditya once again, and today we are going to learn one more interesting topic, that is conditioning, classical and operant conditioning, reinforcement, punishment and extinction, and transference and countertransference. This is important for both USMLE and I hope a little bit for PLAB and NCLEX too. So basically in this we need to understand what is classical conditioning, what is operant conditioning, what is reinforcement, what is punishment. Sometimes it's confusing to identify positive reinforcement, negative reinforcement, positive and negative punishment, and then we also need to understand transference and countertransference. So let's proceed. There is one famous experiment by Pavlov called as Pavlov's dog experiment. Okay, so in this experiment, every time Pavlov gave food to his dog, he rang a bell. After repeating this many times, just ringing the bell with no food made the dog salivate. The bell became a conditioned stimulus which initiated the involuntary or automatic response, that is salivation of the dog. So this is classical conditioning. So a neutral stimulus like a bell is repeatedly paired with a stimulus that naturally causes a response like food causing salivation. Over time the neutral stimulus alone triggers the same response even without the food. So this is classical conditioning, and this type of learning produces automatic response or involuntary response. So having known about classical conditioning, there are not much questions regarding classical conditioning, but yes, with operant conditioning there are questions. So operant conditioning is learning through consequences. You do something happens, that outcome changes whether you do it again. Okay, unlike classical conditioning, which is automatic, operant conditioning involves voluntary or conscious actions. Okay, there is simple formula. Good consequence means behavior increase, bad consequence means behavior decrease, and no consequence means behavior fade away. Okay, there is one Skinner's rat experiment. A rat is in a box accidentally pressed a lever and got food. It kept pressing the lever more and more. When pressing the lever gave an electric shock, it stopped pressing. The rat learned from the outcome. That means it learned that, okay, on pressing the lever I'm going to get food. So that increases behavior. That was positive reinforcement. Okay, we'll talk about this later. And that increases behavior, but when it started getting shocked, it stopped doing that. So that's called as punishment. Okay, and so in this way, whether it did more and more pressing of the lever or it stopped pressing the lever, that means its behavior is changed or behavior is manipulated based on the consequence of the action. Okay, so this is operant conditioning. Now we have to learn this slide, very important. It's very important. Okay, reinforcement, punishment and extinction. In operant conditioning, behaviors are shaped by what happens after them. If something good follows, you do it more. If something bad follows, you do it less. If nothing follows, you eventually stop. Skinner's 4 quadrants made simple. So this is important. So what we have to know is that if there is behavior increase, that means if the good thing is continuously done after some experiment, let's say, then we say that the behavior increase. Similarly, to increase the behavior, there must be either positive reinforcement, okay, or negative reinforcement. Okay, similarly, if you have to decrease the behavior, then there should be either positive punishment or there should be negative punishment. So whenever you want to increase the behavior, increase the good behavior, then either you have to add the positive reinforcement or you have to do the negative reinforcement. That means we'll read now soon. And similarly, if you want to decrease the behavior, then either you have to do positive punishment or negative punishment. So reinforcement is linked to increasing behavior, whereas punishment is linked to decreasing behavior. Now let's learn what is positive reinforcement and what is negative reinforcement. So if on giving a reward, example, let's say praising a child for good grades, the child in fact now increases his behavior of studying more and more, right? So the behavior is increased because of the positive reinforcement, that is giving a child a reward or praising a child. So this is called as this action of giving the child a reward or praising a child is called as positive reinforcement, where something is added. Okay, that means either giving a reward is added or praising a child is added. So because of that, now the child is studying more and more, so that is called as positive reinforcement, leading to increased behavior. Now sometimes, let's say, removing something unpleasant also leads to behavior increase. This is known as negative reinforcement. Example, if you have to wake up early in the morning and you keep an alarm, you wake up early in the morning just to switch off that alarm. That is the alarm, the annoying noise of alarm. So to switching off the alarm or removing the sound of the alarm, you are taking away something. So that is called as negative reinforcement. You are switching off the alarm or removing the sound of the alarm. That particular action where you are not adding but rather taking away the alarm or removing the sound of the alarm, that is leading to increase in behavior. That means because of that, now you are waking up early from the bed for work, for school. That is called as negative reinforcement. Okay, something is being taken out but still your behavior is increased. That is known as negative reinforcement. Something is added, and because of that, like praising a child or giving reward to a child, because of that behavior is increased. That is the child is studying more. That is called as positive reinforcement. Now let's talk about punishment. Behavior decrease. So if you add something unpleasant, example, if the child is doing some mischievous activity, and because of that he or she has to do extra chores in the home, then that is called as positive punishment. Now why is it done? Positive punishment is given so with the thought that now the behavior of the child decreases, the misbehavior of the child decreases. That is positive punishment. And negative punishment is taking away something good, like the child is to enjoy screen time with his gadgets. Now since he is being mischievous at home, now the parents take away the gadgets. Now because of that, something is being taken away. Because of that, why is it taken away? The action of taking away is negative punishment. And why is it done? It is done to decrease the behavior, to decrease the bad behavior of being mischievous. Okay, so this is called as negative punishment. So we have to understand this table. Okay, this is really important. And now let's talk about extinction. When reinforcement is completely stopped, the behavior is gradually disappears on its own, like fire going out without the fuel. So it works in both classical and operant conditioning. So even if the behavior is established, okay, the desired behavior is established, the desired action is established, but if you stop giving the reinforcement, then that behavior gradually fades away. That is called as extinction. Okay, this punishment, again, same thing, adding something unpleasant is positive punishment, or taking away something enjoyable, that is negative punishment, to stop an unwanted behavior. Okay, punishment behavior question, we have studied about this already. Now next is transference and countertransference. Transference is, this is when a patient unconsciously redirects feelings from someone in their past, like a parent or ex, onto the doctor or therapist. Example, a patient starts treating their psychiatrist like a strict parent, feeling afraid to speak up, just like they did at home. In this case, transference, the patient relates the doctor to someone in the family. Okay, so it's the patient thinking, not the doctor thinking. The patient is thinking that the doctor or the therapist is somewhat their family or their parents back home. So this is called as transference. Okay, in this example, the patient is thinking that the psychiatrist or the therapist is maybe strict because he is relating that therapist or psychiatrist to his father back home, who is a strict man. So this is called as transference. And if countertransference, this is when the doctor or the therapist unconsciously projects their own feeling from personal life onto the patient. Example, a therapist feels overprotective of a young patient because they remind them of their little siblings. So this is countertransference. So I hope with this we completed about the what is classical conditioning, what is operant conditioning, what is punishment, what is reinforcement, what is extinction, what is transference, and what is countertransference. These are very important topics. Now I have few of the questions in examination from USMLE types of questions. Okay, USMLE step 1, step 2, and step 3 type of questions. You once go through it, you can pause the video here and once go through the questions. These are just the questions related to what we have spoken, what you have read right now, and I hope this will entice you more to study more. It will encourage you to study more. So yeah, here you have chosen conditional stimulus, your transference. So the questions are more or less like this in the examinations. Acknowledge the counter transference and seek supervision. So I want you to pause the video here and go through these questions and answers and an explanation. Similarly, if you are preparing for NCLEX, I want you to go through these questions, NCLEX 1, 2 and 3 questions. Pause your video here and go through these questions. Okay, I hope you study more. I hope your concept are clear, and I hope you will be able to solve this type of questions in your examinations. Now I'd love to see you more in the future videos. Okay, see you, bye, take care.